Hi, today I'd like to talk about the relationship between pain, cancer, depression. Them three things are quite commonly interrelated. And when we're first diagnosed with cancer, as I was myself in 2023, it's sometimes surreal. For me, it didn't really sink in right away until I was rushed into hospital. And obviously, you have a lot of tests, and then it starts to sink in. And fear comes about, pain comes about, anger can come about, depression, anxiety, hurt, and all of these emotions that we have to try and negotiate. So let's try and break them down and have a look what really happens here. First of all, let's have a look at the relationship between anger and depression. Most commonly, occurrence of depression manifest as a result of repressing or suppressing anger. What we do, we feel angry, but perhaps we've been brought up to believe that anger is wrong and we shouldn't get angry, and it's not. We all get angry, it's part of the human condition, but we need to learn to express our anger in a contained environment. Sometimes that's writing a letter. I'm not saying to send it to somebody, but just a way of expressing it. Some people scream into pillars. Some people will go out and do physical exercise, but we must express our anger. Most commonly, the best antidote to anger is to talk about it. Talk about it to a counsellor or talk about it to a friend, okay? But we don't. We defend ourselves against anger, and what we commonly do is shove it down. And when our mind shoves it down for us, we don't do it consciously. It's known as repression, which is the unconscious exclusion of information. Our mind is a wonderful thing, and it will defend us against pain. And instead of us feeling pain, we often become angry. If we feel that anger is wrong, then we'll shove it down. And this often manifests, repressed anger often manifests as depression and anxiety. Anger is an energy, therefore it's neither born or dies. It changes form. Therefore, if we shove it down, it's not dead and buried, it's buried alive. And it will find another form of manifestation, which is often depression and anxiety. So there we've got the relationship between anger and depression. And commonly, we do feel anger when we get into the treatment, particularly for cancer. Quite often the treatment is worse than the cancer itself, as many people will verify who have been through the procedures. And we can become angry at losing our sense of self, angry at losing our jobs, angry at losing our life, again angry at losing our sense of self, angry at losing our purpose in life. And this anger often manifests because, again, the mind is a wonderful thing. It's defending us against pain. So anger is often a reactionary emotion, a secondary emotion, when the authentic emotion, what we're really feeling, is pain. And anger, in a sense, lets us get close to pain, but it doesn't let us feel that pain in its entirety. And that's often the purpose of anger in this context. So what happens, we feel all of these things, we feel we've been denied, in a sense, many things in life. For instance, myself was planning for retirement. I wanted to travel. I wanted to carry on work until I was in my 80s and things like that. And initially that was very, very difficult. I'm actually managing some of these things now, which is great. But at first I didn't think I could do them. I was that fatigued and feeling nauseous and whatever. I didn't think I could do these things. So inside I was extremely angry. But again, I didn't particularly show my anger. It turned to depression. And like I said before, the reason anger comes in at that point is to defend us from the pain of our diagnosis, from the pain of living with cancer. So what is the antidote? You know, what do we have to do here? Well, we have to feel pain in its entirety. And it's best done, it's best done in a safe, contained environment, maybe with a counsellor, maybe with a friend who's very understanding. But mindfulness, allowing ourselves to feel that pain without judging it, good, bad, or indifferent. If we feel pain, we process it. If we don't feel pain, it gets stuck within us. And when it gets stuck within us, it often manifests as depression. And we all know many of us know what depression is like. I've never suffered from depression in my life up until the last year. And many of the side effects from the cancer drugs ended up with me getting chronic depression, quite frankly, and anxiety, panic attacks, things I've never had in my life. I'm managing them, and I will do another video on how to manage them. But just for this one, let's just reiterate, we have pain. Human beings are genetically geared, if you like, to avoid pain. So it will come out as another emotion. Often this is anger, and often we feel it inappropriate to express our anger, so we shove it down. Sometimes we shove it down, we put it on the back boiler, as we say. That is suppression. Sometimes our mind will just shove it down for us, and we'll do it unconsciously. That is repression. And anger is often a secondary emotion that comes up to help us defend ourselves against the enormity of the pain that we can feel. Okay, nobody really wants to feel that pain. So we shove it down, it becomes depression, okay, it becomes anxiety. And just to finish this short video, the answer to this problem, to alleviate the depression and the anxiety, is to express our pain. If we do feel angry, that's fine, but express the anger. And we'll almost always find that under anger, behind anger, is pain or hurt. And once we get to that pain and hurt, we'll probably feel quite emotional, but then we'll process it. It becomes a process then. And the process is always moving. It can move through us. So be prepared to express your anger. Be prepared to express your pain and your hurt, and it will move through you. Thank you.